So today we're going to talk about how medical practices can use new marketing tools in an industry transformed by the Affordable Care Act. Now, what is the biggest problem affecting the age management medicine industry? What do you guys think is your biggest problem as an industry? It's that people don't take you seriously. What did you say? Kind of, but it's going broader. It's that people don't take you seriously. They don't truly understand what you do. Age management has long been considered surgery, fillers, Botox, cosmeceuticals, all about making you look good on the outside. But we have today that age management medicine is about delving deeper. It's about reversing the aging process from within. And the crux is getting people to really understand what that means. But there is mistrust, and we have to fix that. And in the next hour, I will share with you how we've helped our clients build trust and credibility and how you can do that for your area of medicine. Why do I know this? Is because for the last 10 years, me and my team at Quantis, a marketing and advertising agency focusing in the healthcare industry, this is what we've been doing for our clients. People have to trust the industry before they can trust the brand, and they have to trust the brand before they can trust the service. So before you can begin marketing your specific service lines and treatments for age management, you have to take a step back and market the entire industry. But in order to do that, you have to understand the broader implications of what's happening within your industry. And today I will talk about some of these trends that are currently shaping the healthcare system and how your industry and your practices can benefit from these positive changes in the new laws mandated by the Affordable Care Act. So let me give you a preview of the key trends that are currently changing the healthcare system. First is that baby boomers are aging. Because of the Affordable Care Act, there are going to be greater funding towards preventative health care. More and more medical practices are moving towards an integrated practice model. There are going to be less traditional physicians in the healthcare system. And there's going to be greater demand for preventative care by the newly insured and the aging population. So this means that if there's going to be an opportunity for you to take market share from the traditional healthcare system into the age management system. Let's talk about how that's going to happen. Who do you guys think is your most important target audience? Somebody said baby boomers over here. And that's correct. Baby boomers is your most important target audience. They are people aged between the ages of 49 to 67. And there are over 77 million baby boomers in the U.S. today. Baby boomers make up 35% of the American population. And in 2 years, those aged 50 and above will make up 45% of that population. And we all here today know that we live in a culture that glamorizes youth. Perfect example was last week when top headline news on major news websites was Kim Kardashian's post-baby pictures. Because our culture idolizes youth and beauty and vitality, baby boomers today will do as much as they possibly can to stay young, active, and healthy. But to do that, they are going to seek preventative care measures to reverse the aging process, both on the outside as well as within. Currently today, people spend over $80 billion in anti-aging products. That's $80 billion. And in 2 years, that number is expected to rise to $115 billion. The question is how do you get these people, boomers in particular, to become your customers? And how do you capture a portion of that $80 billion market? Because remember that capturing these boomers is a zero-sum game. If you're not doing it, somebody else is. It all has to do with claiming value. And I'll show you how we've done that for our healthcare clients by rewriting their message, creating a targeted marketing strategy directed at their most important audience, and building brand equity. We have over 10 years of experience in building brands for our clients, so we've had some pretty good insights in how you can increase market share, get new patients, and tap into this $80 billion market. The next area I want to talk about is the aging population. As you can see from here, overall U.S. life expectancy is increasing. average life expectancy is now at 78 years old, and by 2050, it's expected to be at 84. But while we're aging and living longer, overall quality of life is decreasing because of the aging population being plagued by chronic disease, which is putting a lot of pressure into the health management system, which reinforces the need for preventative care. I now want to talk about the next area that's going to directly impact you, the Affordable Care Act. Now, how many of you have read the Affordable Care Act? I have, and let me tell you, it's a great cure for insomnia. But there are some very exciting changes tied to the Affordable Care Act that are actually going to help you in the field of age management by opening up the opportunity for you to take market share from the traditional system. But you have to know how to grab it. So let's break this down a little bit. For one thing, one of the top mandates of the Affordable Care Act is prevention. And that's because 75% of all healthcare spending today is spent on chronic diseases, which could be preventable. Prevention is the next business opportunity. One of the most important mandates of these ACA is greater funding for preventative measures. This is a sample of the essential health benefits that are now being required by anyone who has insurance if they want to comply with the ACA. So, if your practices can begin offering preventative treatments that comply with these essential health benefit programs, you can begin to capitalize on this greater mandate by the ACA for preventative health care. And some of these services could even be covered by insurance. Because at the core of what you do as age management physicians, it's prevention of the aging process. So the more services you can begin offering that comply with the ACA's preventative health care mandates, the more you will be able to capture these patients who must have these essential health benefits and also want to comply with, and also want to prevent their own aging process. About a week ago, I was watching Jimmy Fallon interview an actress on television, and she said that at 64 years old, she felt better than she had her entire life. And I'm thinking, really? Because let's face it, thanks to the aging process, we don't actually think that as each year goes by, you can actually feel better. In fact, being a woman, I feel like it's especially hard on us, where it seems that we are constantly reminded that we have a sell-by date. But the field that you're pioneering is working to change that, and it starts with prevention. Prevention is the key that will help extend our sell-by date. The next trend I want to talk about that is a direct result of the ACA is this movement towards an integrated care practice model. More and more practices are moving away from offering independent practices that are offering limited single-service treatments. They are moving towards an integrated practice model that maximizes value for patients. This results in serious changes in how healthcare is being delivered. It's moving away from a supply-driven system organized around what physicians do towards a patient-centered system around what patients need. It's shifting the focus from the volume and profitability of services, physician visits, hospitalizations, procedures, and tests, to patient outcomes achieved. It's organizing a practice around patients' medical conditions rather than physicians' medical specialties. And rather than fee-for-service arrangements, it's developing bundled prices for the full cycle of care. This transformation is already underway by leading healthcare groups. Organizations like Cleveland Clinic and Johns Hopkins have already undertaken large-scale changes involving the value agenda. And consumers are rewarding those companies that create value for them. So remember what I talked about earlier, that the way you grab market share is by claiming patient value. This is how leading healthcare organizations are claiming value for their patients. And this is how you can learn from them.